Today, we are diving into the hidden systems that are constantly working to manage inflammation inside your body. We're going to look at what happens when things go wrong, from common conditions like gout to really complex autoimmune diseases like lupus. But let's kick things off with something you can actually use, something incredibly practical, a simple routine to support your body's internal flow. Think of it as a daily tune-up for your entire immune system.
So this routine, which a lot of physical therapists recommend, is broken down into 3 super simple 1-minute stages. First up, you do a minute of deep belly breathing. This really gets that central system going. Second, you spend a minute making gentle circles over key lymph nodes, under your jaw, just above your collarbone, in your armpits, and in your groin. And finally, you finish with 1 minute of simple movement, something like marching in place, just to get all that fluid moving.
I know what you're thinking. 3 minutes? It sounds almost too simple, right? But this short little routine taps into one of the body's most important and honestly most overlooked networks. Let's take a look at what's actually happening under the skin.
That whole 3-minute routine is all about stimulating the system. So let's zoom in and talk about the body's essential drainage and security network. It's really the unsung hero of your immune health.
The easiest way to think about it, imagine your city's sanitation department and its entire highway system all rolled into one. The lymphatic system is constantly clearing out waste products, cellular junk, and toxins, but it's also the main highway for your immune cells to travel on.
And this diagram right here shows that highway in action. What you're seeing is how these specialized immune cells, they're called dendritic cells, act like little scouts. They use these lymphatic vessels to travel to command centers, your lymph nodes, to report back on what they found out in the field. So you see, it's not just a plumbing system, it's an active, intelligent information network that's constantly regulating your immune response.
Okay, so this is where keeping that flow moving becomes so important. What happens when the whole drainage system gets overwhelmed? Well, let's look at gout, which is basically a condition caused by a kind of inflammatory traffic jam.
It all starts with something called hyperuricemia, which is really just a fancy way of saying there's way too much uric acid, a type of waste product, floating around in the blood. When there's too much, this acid can form these nasty, sharp, needle-like crystals to get stuck in the joints, and that is what triggers that incredibly painful inflammatory response.
Now, while diet alone usually isn't a silver bullet for managing gout, it can be a really important part of the plan. It basically comes down to limiting foods that are high in something called purines. These are natural compounds that your body breaks down into uric acid. We're talking things like red meat and certain kinds of seafood. By cutting back, you can help lower the amount of waste your body has to process.
And getting a handle on gout is absolutely critical. Research shows it's linked to a 17% higher risk of death from any cause. That's a huge number. And the most common cause of death for these patients, it's cardiovascular disease. So the goal with modern treatment isn't just about putting out the fire during a flare-up. No, it's a proactive strategy called treat to target. Doctors want to get your uric acid levels down below a specific number, 6 milligrams per deciliter, because at that level, existing crystals can actually dissolve and new ones are prevented from forming in the first place. All right, so gout is a problem of overflow, of a system getting clogged. But what happens when the body's own security system malfunctions and starts attacking itself? That's what we're going to explore next with lupus.
This diagram here does a brilliant job of showing the imbalance at the very heart of lupus. So think of your B cells as little factories that produce antibodies to fight off invaders. Normally, these factories have super strict quality control. But in lupus, as you can see here, some of the B cells take an unregulated side path, this extrafollicular pathway, and they just start pumping out faulty antibodies with no checks and balances. And that leads to some very dangerous mistakes.
And that misfire has a name: autoantibodies. The immune system gets confused. It starts making antibodies that target the body's own healthy cells. So unlike the clog we see in gout, lupus is a case of friendly fire, where the security system ends up attacking the very city it's supposed to be protecting. So you see, whether we're talking about an overflow like in gout or a system error like in lupus, really understanding these internal mechanisms is the absolute first step toward managing them better. And a huge part of that management often involves dealing with chronic pain. And look, managing the pain that comes with these conditions is a massive challenge. As you can see from this table, the rates of chronic opioid use are incredibly high for patients. I mean, more than a third of people with lupus, for example.
But here's the crazy paradox. A major review in 2022 came to this really stark conclusion.
Despite how incredibly common they are, there is literally no data showing that long-term opioids actually improve function or quality of life or even pain control for these patients.
So what's the real takeaway here? The bottom line is that it's all connected. That simple 3-minute routine we started with, it isn't just about feeling good in the moment. It supports the very system that can get overwhelmed in a condition like gout or misfire so badly in a disease like lupus. Just grasping the difference between an overflow problem and a self-attack problem empowers you to have better conversations with your doctor and take a much more active role in your own health.
We've really only scratched the surface today, but it all comes back to this one powerful idea. Our bodies have this incredible, invisible network working for us 24/7, and it leaves us with a question to think about. How will you help it flow?